And welcome to the Factor Uncensored. Glad you could stay up with us tonight. Glad to see you. We have a great program prepared for you. Let's begin here. Weight loss is a very popular resolution for the new year. A lot of people have been turning to meds on the market to help take off the extra weight. But before taking a dose of those weight loss drugs, one should consider a very serious and new warning from the Food and Drug Administration. My next guest has a vital information. Joining us on the Factor Uncensored tonight, Dr. Danish Ali with Archpoint Pain Institute. Dr. Ali, we knew with the popularity of these drugs, Ozempic and many others out there, that we may see a situation like this that we're hearing from the FDA, where they're saying there could be side effects, additional side effects from using these drugs that were initially for diabetes. Now many people are using them for weight loss. So tell us a little bit about what we're hearing from the Food and Drug Administration on this of concern.
Yeah, Isaiah. So we know that some of these medications and injections do cause bowel obstruction. They cause bowel paralysis and even pancreatitis. The reason for this is the mechanism behind these drugs is that they slow down the stomach's production, and it slows the transition of the food and its contents. And so it delays gastric emptying. Therefore, you feel fuller sooner. These are known side effects: the bowel obstruction, the pancreatitis, and also paralysis of the bowels, and that's listed on there.
Yeah, now, that's nothing new. That's nothing new. People went in knowing this could happen. Now let's talk about what the FDA says. They're getting reports about some concerning side effects.
That's correct, Isaiah. And two of those specifically, one being suicidal ideations. They're seeing a report or an incidence of these medications possibly. Again, this has not been proven yet, Isaiah. And there's a lot of research that the FDA is doing right now, and they're looking at all these cases as well specifically to see if there is a correlation between, number one, the suicidal ideations, and also, number two, hair loss. That's the other thing that folks saw in some of these cases that they've been now that they're going to start analyzing even further, is that there was this potential correlation between these medications and alopecia or hair loss and suicidal ideations.
So what is the FDA recommending for users out there if you are on these drugs? And I think they're three very popular drugs, and there could be more out there on the market. What are they recommending to you? Are they saying don't use them anymore, or use them with caution, or we don't have anything definitive yet?
Sure, yeah. So their recommendation right now is talk to your primary care doctor, talk to your prescribing physician who has prescribed these medications, be aware of these potential side effects, and if you do experience any of these, then stop the medication immediately and talk to your primary care doctor or physician who's prescribing these medications to you.
Now, does the FDA plan on investigating this more, or they're saying, here's what we're hearing, good luck, guys?
They are 100% evaluating this in further detail. Again, with any medication, Isaiah, it takes years of research. It takes, folks who get these medications for us to see a possible link or a correlation between things. And so, this drug, this medication got very popular in its onset. And because of that, now we're realizing some of these other potential side effects that may be existing with that. Again, it doesn't mean that every patient will get it. It's like any drug that you may take, it may have side effects. The FDA's job is to explore this further and to make it clear if there is any sort of correlation between the two.
Now, if you find yourself with your hair falling out, the condition we all know is alopecia, what would you recommend to a person if they're using one of these drugs? Would you say stop and go see a doctor about the loss of hair, or what?
Stop it immediately and talk to the prescribing physician. Whoever has prescribed this medication, whether it would be a weight loss physician or a primary care doctor, whoever may have given you this medication, speak with them immediately. The other thing of note, Isaiah, is if you have any history of psychiatric illness or potentially suicidal ideations with other medications, or or maybe depression, those are all things that you want to be careful of, especially if there is a potential risk that this may cause suicidal ideations. You want to talk to your primary doctor. You want to talk to your physician before you start this medication for sure.
Obviously, this will be on the checklist for many doctors and healthcare providers now that we know to check about your mental health evaluation, to check about hair loss as well, because this could intensify it.
That's correct, Isaiah. And those are things that's why you want to talk to. I discourage folks to obtain these medications from their friends, from the street. These are things that are controlled. These medications do have side effects. And so we want to make sure that we put it in the right hands for the right patients, so we see the right results as well, Isaiah.
All right, Dr. Donna Lee, Arch Point Pain Institute. We want to thank you for joining us tonight and your valuable guidance on this situation. Very popular drug. A lot of people are using it as of now. Thank you, sir. We appreciate you joining us here on The Factor Uncensored. Welcome back to The Factor Uncensored. The FDA is looking into possible side effects for drugs that treat both diabetes and weight loss at the same time if you need it for both. This includes medications like Ozempic, Mounjaro, and Wegovy. This comes after reports of people experiencing hair loss and suicidal thoughts after using them. One of my next guests lost weight using Ozempic. She tells me she experienced her own personal side effect and had to get off the medication. Our guests are here on The Factor Uncensored. We have with us Sherry Hendrinos and Karen Diamant. Glad to have you both here. Are you all bothered by this latest information from the Food and Drug Administration talking about these additional side effects that you could have from these weight loss / diabetes drugs that many people are using right now? Sherry, let's begin with you.
It's funny because I think I told you a couple weeks ago I wanted to try it. And I was like, I just want to lose 15 pounds and be summer ready. But because I'm also going on this IVF journey, which I've been pretty public about, there are things that, I think people don't think about. And if you are trying to get pregnant or conceive sometime soon, or even going through IVF like I am, you cannot take those. So for me, I've always been a person that loves sports and athletic. I don't mind the working out part, right? But it's always, sometimes I think we like immediate gratification. So I was one of those people like, oh, I just want to take this for a month and drop 10, 15 pounds and I'm good for summer. So that was my thought process on it. I don't think I'm mad. I just think that we need to educate ourselves a little more before we do things sometimes.
Mm-hmm. And of course you have it, but you've placed it away because it's not good for you right now, according to your doctors.
Yeah, I have it. I went and got it from a different doctor, not the fertility specialist, but I did get it. It's in my fridge. I haven't used it because of the journey I'm on, right now. And even though that journey is a lot of ups and downs, and you do take breaks in the medication for IVF, pending your situation, they just said, please don't take it because it can cause birth, it could cause a lot of issues in a pregnancy. And if you're considered high risk, like someone like me, I just don't want to take any type of risks like that.
Absolutely. Now, Karen, you were on it for about 8 weeks and you didn't have any of the new side effects that we're hearing about, but you did have a difficulty after taking it, right?
Yeah, thankfully so. I didn't have any of the extreme side effects, and we've heard of several. There's a lot of things that we don't know about the drug. My personal experience with it was that it just caused severe digestive issues, and I didn't want to deal with that. I don't mind working out. I adopted a healthy lifestyle 15 years ago after a 60-pound transformation. So I kind of have adopted that into my daily normal diet and lifestyle. And when I was taking the drug, I just was encountering a lot of digestive issues. And not only that, it was easy for me to like cheat on my diet or eat sugary foods just because I knew I was only going to have a little bit. So I was making dietary concessions with myself that I normally wouldn't make on a normal day.
And Sherry, for those who are out there, you have seen people who have done it successfully, but we're hearing about a plateau now because it's not that holistic approach where you're including good eating exercise with it. You just want the drug and the drug to do the work.
Right. I saw a girl I went to high school with posted on her Facebook page. She looks great. She lost 60 pounds, but in the comments, she wrote she's plateaued. I think one thing, and I want to mention, because I've worked with some doctors that prescribe Ozempic, that you should go to a doctor. Don't go to a random person. Don't go to your friend, like, and be like, hey, can you get this off the street? Because I think that the demand for it is causing people to go to the doctor anymore. And you really should be getting like your blood tested, your heart rate, all those, your blood pressure. That should be a part of if you should even be a candidate. And so, yeah, you can't just take it and it'd be a miracle. And I think that's something people are missing out too, but I read online, and like I said, she looks great, but she did mention she plateaued. So she was looking at switching medications. So I don't know what that would be, but I was reading that yesterday.
And go ahead, Karen.
Well, the scariest part about this is that everyone jumped on the Ozempic bandwagon without blinking an eye. But what about the resistance we got to the vaccine? That also comes in the form of an injection, but nobody batted an eyelash when it was time to, for a miracle weight loss drug. But I have also seen that where people not only plateau, but they bounce back. So right after they quit the drug or they stop taking it for whatever reason, if you did not adopt the healthy lifestyles that go with weight management or weight loss, then guess what? You're going to jump right back up.
Absolutely. And we want to remind the viewers that we're not specifically or just talking about Ozempic. There are 3 different popular drugs out there, and the FDA hasn't basically said which one is causing these problems. So we don't want to just put the blame right at the foot of Ozempic. But we want to thank you, ladies, for joining us here on The Factor Uncensored. We appreciate your time.